la comunidad. Con la vacuna todo va a cambiar. Vamos toda mi gente, los doctores no mienten. Piensen en el futuro y no en el presente. Inmunidad para la comunidad. Con gente, los doctores no mienten. Piensen en el futuro y no en el presente.
Hay que parar esta pandemia, ya mucho durado. Se corre tiempo y variantes, hay demasiado. Alfa, beta, gamma y delta. Hay más que quieren romper todas las barreras. Se van para diferentes estados y naciones. Estamos perdiendo tiempo, no queremos distracciones. Dale, vacúnate y es para rápido. El COVID-19 se sigue mutando.
Hermanos, hermanas, vamos toda mi gente. Abuelos, abuelas, los doctores no te mienten. Primos, amigas, amigos, piensa en el futuro y no en el presente.
Inmunidad para la comunidad. Con la vacuna todo va a cambiar. Vamos toda mi gente, los doctores no mienten. Piensen en el futuro y no en el presente. Inmunidad para la comunidad. Con la vacuna todo va a cambiar. Vamos toda mi gente, los doctores no mienten. Piensen en el futuro y no en el presente.
Good evening and welcome, everyone. My name is Dr. Max Gomez. I am the senior medical correspondent for CBS here in New York. But more importantly, let me tell you why we are here this evening. This is going to be an evening with 3 practicing doctors who are also part of HipHop Public Health. And we'll tell you why that's important. HipHop Public Health is a nonprofit that uses a research-based approach of music plus culture plus science, turns into kind of a health communication equation, if you will, to share vital health information, engage communities in conversations, and inspire positive health change. So important, especially these days. So tonight, we'll talk about HipHop Public Health's Community Immunity and Inmunidad Comunidad and anthologies, and what these doctors hope to achieve by harnessing the power of music, science, and culture to increase COVID-19 vaccine confidence and uptake, especially, right? So let's start out by asking each one of our distinguished panelists here to introduce themselves, tell us what their credentials are, and especially what their hip-hop alter ego is. So let's start with the boss, Dr. Olajide Williams, aka the Hip Hop Doc.
Thanks, Max. So that's my alter ego. That's my hip hop persona right there, the hip hop doc. And I have to credit Dougie Fresh for coming up with that name. But I'm also a professor of neurology at Columbia University. I'm the chief of staff of neurology, and I'm also the founder of HipHop Public Health, and I'm delighted by the incredible team being led by Lori Benson, our CEO. And so I'm excited to be here.
Great. Thank you. And so next up is Dr. Monique Hedman Maxey, aka Docta Mo Flow. Tell us about that.
Hi, I'm very happy to be here. I am a proud advisory board member of HipHop Public Health, a resident physician. I'm still in my training here in Los Angeles at Harvard UCLA Medical Center. And Jide, Dr. Williams, has been my mentor and really believed in me and set me up so I could pursue a medical career. So it's an honor to continue working with him and the rest of HipHop Public Health in this capacity.
Cool. Thank you. Now we have Dr. Anna Sapine, aka Doctora Anna G. Anna, tell us about yourself.
Hi, yes. So I'm also very happy to be here, as is my alter ego, Dr. Anna G. I am also at Columbia. I am an OBGYN and am especially proud of a role that I have as Director of Community Women's Health. And so what I do is look at different ways that we can help improve the health outcomes of the women of our community. And so I'm especially happy to be here today. And yes, Dr. Anna G is the alter ego for this hip hop opportunity.
Good deal. Now, as we get into our conversation, I want to make it clear that I have asked and gotten permission from each of our distinguished panelists to address them by maybe not their hip hop alter ego, but Dr. Williams is Jide, Dr. Hedman Maxi is Mo, and Dr. Anna Sapine, Doctora Anna G, we're just going to call you plain old Anna. Is that okay?
That is good.
Okay, good deal. So let me set this up a little bit here for us. This shouldn't be a secret to anybody, but today we're in a world filled with all kinds of information, particularly scientific and medical information and misinformation, right? And I've always said that it's kind of behavior modification 101. If we want to get people to do things that are going to protect themselves, that are good for their own health, whether it's vaccines or a million other things, we have to have a culturally appropriate message and messenger, right? And that's how we connect with one another and explore these vital public health topics, is we've got to have the right message and the right route of getting this to people. And we're going to explore some of that this evening. You're going to see some really cool videos and things that I think are going to help break through some of the noise and get to the exact populations that we're trying to reach. But let's start out with, as doctors and medical professionals, all of you know the importance of sort of checking in at the start of any visit, right? So let's start out with a check-in with you guys, because I'm sure you guys have been under the gun. It's been a tough time for medical professionals, even more so than normal recently. So tell us a little bit about how you're doing sort of personally and professionally, including your hip-hop alter ego here. Mo, why don't we start with you?
Well, I'm doing well overall. I will say that in general, medical training is not for the faint of heart, as all of you know very well. And it was a pretty challenging experience going through my intern year at the height of the COVID pandemic. But I really love my residency program. I'm proud of the work we're doing. I'm a proud employee of LA County, serving its vulnerable residents. And also personally, as I'm sure you all also understand, trying to be intentional about investing in my physical and mental health through all of this, staying active, eating well. Yes. And,
right. If you don't take care of yourself, you're not going to be able to take care of other people. So good. I'm glad to hear that. Anna, what about you?
I would also echo that it has been a really rough couple of years. Now it's essentially a couple of years that we've been going through this. And so I'm doing okay, I'm doing well. But I also feel like one of the things that I do is try to channel a lot of the emotions that I have related to what we've gone through and are still going through into doing work that I think is really important. So just like Mo says that she's looking to do things to make sure that she's being taking care of her well-being. That's what I do in terms of the work that I do. So I feel that it's an opportunity for me to channel all the emotions of what we've been through in doing this work.
Yeah, and I think if you are honest with patients and people you're trying to reach, that you yourself have experienced these things. You're not like this superwoman that, doesn't have some of these emotions or some of the same difficulties that all the rest of us are going through. I think if you can acknowledge that, I think that helps you communicate with your patients. Jide, what do you think about that?
No, I agree. I feel so blessed and fortunate. When you work in our profession and in the middle of one of the worst global pandemic in the world's history, and you see what we have seen on the front lines, you feel incredibly fortunate to be alive. Yes, it was exhausting. It still is exhausting emotionally, mentally, physically. But what continues to refuel me is the sheer feeling of being blessed to be in the position to be saving a life and not struggling to survive a pandemic. So I feel incredibly blessed. I also want to say that on a private level, my children are healthy. My entire family is healthy. I didn't lose anyone in my personal family during the pandemic. There's so many people who've lost people to the pandemic. So, I mean, overall, I really have no reason to complain. I have every reason to feel fortunate and blessed.
Well, you've still been through a very stressful time, so we'll give you a little break there to complain every once in a while, at least privately, okay? So, hip hop public health, a lot of the foundation of hip hop public health is music, right? And I think we can all identify with the power of music to engage us, to spark emotion, to bring people together. It has a remarkable way of Olajide, you know, as a neurologist, and you know that was my training as well. It seems to work through different pathways somehow in the brain, and I've seen that with patients with dementia. My father with Alzheimer's. You play music to them, and suddenly they kind of connect with their youth or whatever. So let's talk about the power of music here to get across the message that we're trying to get across to people. Jide, since you were the founder of that, how did you hit on this? Why music?
Well, you hit the nail on the head. You know, music is miraculous, Max. Music is truly miraculous. It's, you know, I just as a tangible example, to just show the power of music, you know, in just overcoming so many challenges that the brain has to confront every day. If we have a patient that cannot speak, completely mute, we call this aphasia, and the patient can barely speak, struggling to find the words, and we're at the bedside, we can ask the patient to sing. This is a patient that's had a devastating stroke, is unable to produce coherent speech. We ask the patient to sing a familiar song. Max, this is the most miraculous thing you can see at the bedside.
It's amazing.
The patient will start singing, even though the patient can't speak. And that is the power of music. You know, Max, music occupies more real estate in our brains than language itself.
Wow.
That's, think about that. You know, we use our voice to speak every day, and yet music takes up more room in our brain. That just begins to show why children learn their ABCs through song. Why when we're down and out, a song can lift us up. Why the great civil rights marches were powered by incredible victory songs. Music is transformative, and in every one of our lives, we have examples of that. And so when you look at this power of music to move behavior, to move minds, to help us learn, to help us retain and remember, you wonder, why don't we engage this more systematically for health? And therein lies the genesis of hip hop public health, using this powerful art form that's innate, natural, and almost genetically wired to our souls, using it to motivate health and healthy behaviors.
Wow, that's great. And in fact, I think that's the answer to a trivia question: is what was the first musical instrument ever? Right, the human voice. It was it. And as you said, if you can get a patient who has aphasia to sing, to get music out this way, why can't we turn it around and use music to come back in and change behavior? It sounds like sort of health behavior 101. Anna, what has been your experience with music primarily, or other art as a vehicle to get people to pay attention?
So this is my first experience with using music to get people to pay attention, but I have a lot of personal experience with music, and I would agree that music is transformative. I think that all these very strong memories and emotions, thinking back to my youth, thinking back to happy times and sad times, music is a big part of that. And so it holds a very special place in the way one thinks, in the way one experiences things. And so I can certainly see why, without being a neurologist and understanding all the pathways, I can certainly see why music affects us in different ways. And as it relates back to this campaign, for example, the music, the beat is very catchy and it stays in your mind. And so we get this important message across, but because the beat is so catchy, you can't get it out of your mind. So it just stays there. Like, my kids were like, do you know what happened to me today? I was standing on the sideline of a game, and you know what was in my head? That song. So, I can see how it's something that just beyond the message, it's something that can stay and be iterative and continue to reinforce the message because of the way music works and the real estate that it holds in our minds.
So, Monique, how about you? Can you give us an example of how music has been transformative in your life, or how you've seen the effectiveness of music in health?
Well, anyone that asks me knows that I'm a huge hip hop head. And what I can say is that even as a child and even as a teenager, I would say that hip hop, those were my first lessons in sociology. Those were my first lessons in public health. I really feel that hip hop is what really set the foundation for my understanding of the world and what I could potentially bring to it. And aside from that, aside from learning so much from hip hop music and culture, understanding how it is such an effective educational tool. And so just being able to harness the power of that in the context of what we're doing here in Hip Hop Public Health has been really powerful for me. And I really do feel, music, it really imprints upon people's consciousness, both positively and negatively. And it's really important that we are aware of that as public health practitioners in this effort and beyond.
I think I'm back, and I apologize for a technical failure. After this is over, I'm going to go in the other room and shoot my router. But for now, we're going to try to live with it for a little while. How about cultural? What would you call it? Cultural relevance. How is that? I think that varies very much from community to community, doesn't it? To whether it's Latinos, we know can be Cuba, can be some of the other Caribbean countries, it can be Mexico, it can be from all over. Is there a difference there, and what does cultural relevance, do you think, mean, and how do we incorporate that into a way to get people to pay attention, particularly nowadays, about vaccines? We know that the Hispanic community was a little slow in picking that up. Has that changed, and how do we use that?
I can jump in. So, I mean, for me, if you think of cultural relevance, if you just deconstruct those two words, relevance is really the quality or state of being closely connected. That's how we define relevance, the quality of or state of being closely connected. And so cultural relevance is when something is closely connected with a person or a group or a group's culture or their cultural values, and not at odds with it. And so it's really critical for us, in order to relate with diverse groups, it's really critical for us to understand these cultural factors like language and the nuance of communication styles, beliefs and attitudes, and the nuances of cultural behaviors. And by understanding these cultural factors, we can create content that aligns, that is closely connected to that culture. And that way it becomes more meaningful, and it becomes, more readily accepted.
So Anna, though, is there enough common ground between the populations that we're trying to reach there to use hip hop and music to perhaps reach all of them?
I think so. I think that we've become very international. Music is universal, and people throughout the entire world have the opportunity to hear music from the other side of the world.
Mm-hmm.
You talked about the relevance and Latinos, and you talk about being Cuban. So my background is that I'm Dominican, right? So the music that I grew up with was merengue, salsa, but then I grew up in New York, in Washington Heights, and so hip hop was a very big part of my childhood, my growing up. When I did this campaign and shared it with some of my college friends, they're like, "Oh, all that rapping that we did back in college really paid off." So I think that American Latino experience is one that does bring these things together. It brings that Latin background and that Latin beat, incorporates the hip hop. So I think that that it is something that is pretty universal in the Latino community, but also internationally. So, I remember that I was in Switzerland once, and I heard bachata coming from a little restaurant. I was like, how is there bachata in Switzerland? But Dominicans were there. And so I think that this music is music that is well liked, but really speaks to us as Latinos, especially. And so, yes, I totally feel like this is something that is relevant to many people, regardless of their very specific background.
Yeah. And Anna and Mo, I think both of you I'm sure both of you are too young to remember back some years ago where one of the hottest musical genres in Japan was salsa. Yeah. There were some incredible salsa orchestras and bands and singers, and they would sing these beautiful, terrific salsa melodies and tunes completely phonetically. They had no idea what they were actually singing, but salsa was huge in Japan. Mo, give us the West Coast sort of approach or idea here, because I know California is very big now in terms of vaccine mandates and so forth. Is music and hip hop, you think, going to be a tool that we can use to make it easier for people to accept vaccines?
Well, first, let me just apologize if there's a little bit of background noise here, but hopefully you can hear me okay.
All right, I was frozen, so the background noise is no big deal.
I've been fortunate enough, having grown up in Los Angeles and been immersed in like Mexican culture, like Central American culture primarily, and then spending so much time in New York where I was immersed, where I lived in like a predominantly Dominican neighborhood. I was exposed to like Puerto Rican culture. So to have seen both sides of that and experienced the different types of Spanish that we have in the United States, the different types of music, Spanish language music that we have in the United States, has been really amazing for me, and just a really rich experience. And in saying that, I never underestimate the power of music, whether it's hip hop or any kind of music. To bring people together, to send important messages. I do think that could be an effective tool here in Los Angeles and in California, absolutely. But but all of these efforts hopefully can kind of incorporate the rich diversity within Spanish-speaking populations here.
I hope so. We've been doing a lot of talking about music without listening to music. I think it's time to listen to a little music. Lori, do you have a clip there? One of the something from Community Immunity or Comunidad?
One thing
got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity. I'm talking unity for you and me. Yeah. If Doc says it's good, trust me, it's good. Now let's all get the vaccine.
Docta Mo Flow.
It's the hip hop doc, ayy.
We gotta make this pandemic stop.
We on the clock, folks are not trying to get the shot. While we wary of these barriers, cause there's already a lot.
Alpha, beta, gamma, tricky variants like Delta. Others trying to break down our barriers.
They spread to different areas across all nations. We'll never see the end if we keep on waiting.
Let's get it straight. If people don't vaccinate, we know that COVID will continue to spread and mutate.
There's no debate when we gotta keep our loved ones safe.
From the school to the workplace, stay on the case.
And get the facts, ain't no time to relax, and that's fact. Help the body attack so our lives can bounce back.
To be free to move and do the things we do.
We gon' do what we gotta do to get through.
You know, what would be great, Max, is, you know, we talked about culture, and Mo, by the way, man, your flow is crazy on that. Amazing.
Love it.
We talked about culture, and that video we just saw was really focused, targeting, you know, the Afro-American population in general, and you know, the hip hop type of community. But what's interesting is when we created the Spanish version, and I hope we can see that next, you can see how it's completely different, because it was culturally tailored for one group and then culturally tailored for another group. And you'll see the style is different, you know, the whole atmosphere is different. And maybe it's good to see them back to back, so we get a sense of how we culturally tailor these types of videos.
I think we need to see it. Uh-oh.
Comunidad, con la vacuna todo va a cambiar. Vamos toda mi gente, los doctores no mienten. Piensen en el futuro y no en el presente. Inmunidad para la comunidad. Con la vacuna todo va a cambiar. Vamos toda mi gente, los doctores no mienten. Piensen en el futuro y no en el presente.
Doctora Anna G.
¿Cómo estás, doctora Mo?
Tenemos emergencia, no hay mucho tiempo.
¿Creen que la vacuna va a dañar la humanidad?
Pero tenemos todos los datos, simplemente no es verdad.
Recibí la vacuna y se sintió como el flu.
Pero es mejor sentir el flu que el ingresar al ICU.
En mi comunidad todavía hay dudas.
Los números no mienten, la vacuna es segura.
Hermanos,
Ey.
hermanas, vamos toda mi gente. Abuelos, abuelas, los doctores no te mienten. Primo, amigas, amigos, piensa en el futuro y no en el presente.
First things I want to say is I can't believe you found a way to rhyme so many of these words together and use them in hip hop. I'd be completely at a loss there. So what was different there? What was different culturally from example 1 to example 2 that you think was important in reaching people? Mo, since it was yours, tell us that, and then let's see what Anna picked up from that.
It's been an amazing experience for me, you know, as someone who has always been accustomed to rapping in English. But then in my everyday life, like more than half of my patients are Spanish speaking. And so on any given day when I'm seeing patients, I'm speaking Spanish most of the time. So to have this opportunity to rap in Spanish, as someone who, you know, uses Spanish in day-to-day life and who grew up in Los Angeles, in predominantly Latino communities, it's been amazing. I mean, I'm really so very proud of this. I love being on the track with Doctora Anna G. And the feedback that we've gotten is like, wow, this is really cool. The fact that we took, you know, this one song, we translated it into Spanish, we translated it, the language, the culture, everything. Is, I think, really remarkable. I'm very, very proud of this work.
Dr. Anna G, what did you pick up and see that was different there that really spoke better, you think, to the Latino community?
I mean, it's very interesting to me because both speak to me. It's given my unique background of growing up in New York, so hip hop is very much my culture as well. And then, you know, music in Spanish, reggaeton is also something that I really enjoy. So yes, they're different, but there are a lot of us that are part of both worlds, and I think that that's something that's very American. That there are a lot of different musical genres that we enjoy and that we feel are part of our culture. But yeah, no, it was especially nice to be able to do this in Spanish. I feel like that is always something that is really useful, especially also when I see patients. Being able to speak in Spanish is something that it's great for me to be able to connect with patients that way. And I would just say that when this first came out, I was in my practice, and one of the staff members there was talking about how her partner had not yet gotten vaccinated, and that she'd been trying really hard to get him to get vaccinated. And I was like, oh, you should show him my rap video. And so then we all in our practice, everyone got around the screen to watch me rap, and they were like, Doctora Cepin, we didn't know you had this in you. And I'm like, you just don't know me. Like, you know, at work I'm one way, but outside, I too can have fun. So, you know, it was just something that I really enjoyed, but also something that I was able to connect with our staff members around, because it was something that was really fun. And so they were just excited to see one of their doctors doing this work.
Yeah,
I love
notice
that.
Notice Max that the second one, the Spanish one, uses a reggaeton beat. It's a reggaeton flow, a reggaeton style, and it's very popular in the Caribbean, but also in this country and globally. And so you can see how we pivoted into reggaeton for you know, the Spanish version, the use of multiple artists, the use of a family, you know, of you know, the whole community togetherness participating. You know, I think that we really tried to capture some of the nuances of, you know, of life in Spanish culture, at least the ones in New York. But the reggaeton was it, because we chose a genre that not only really resonates in the Caribbean, but it's also universal. It's also global, and I think that helped a lot.
You know, leave it to a doctor to break it down into which beat is what and and how that all works. All I was doing was tapping my feet. I wouldn't have known reggaeton from anything else. But I'm glad that you analyzed it enough to make it that much more relevant. Let's talk about one of the things that has been big lately is the Delta variants and the variants that have popped up. How are you using HipHop Health to address responsiveness to the variants, which is what everybody seems to be talking about and concerned about these days?
Yeah, I mean, I think that one of the things that we did, and we did it very, very quickly, was once the Delta became the dominant strain, we knew that it was really important to put out a video really quickly to kind of break down the Delta, what the Delta variant is. And so we had a video that we produced in English and in Spanish called "What's the Deal with the Variants?" And I believe we have a clip of that, but we thought it was really important to really break down what really is the deal with the variants in simple language, in simple terms, so that people understand just how infectious it is.
Yeah, you've got to address what people are thinking about, talking about, and worried about. Can we hear that? Let's hear that one.
Across all nations, we'll never see the end if we keep on waiting.
Let's get it straight. If people don't vaccinate, we know that COVID will continue to spread and mutate.
There's no debate when we gotta keep our loved ones safe.
From the school to the workplace, stay on the case.
And get the facts, ain't no time to relax, and that's fact. Help the body attack so our lives can bounce back.
To be free to move and do the things we do,
we gon' do what we gotta do to get through.
And we also, Max, we also thought it's important to reinforce wearing a mask, and we'll hopefully we can get to that at the end, but it's critically important, we felt, that for people to recognize that this new variant, it's as infectious as a common cold, it's as infectious as measles, and this is a highly infectious strain, and making sure that we understand the importance of these safety precautions is one way to address it, but most important is to vaccinate. To vaccinate, vaccinate, and vaccinate. It's the only way we're going to get out of this pandemic.
You know, I think the other thing that's interesting here, which we really haven't touched upon, is that I think people might look at some of these and say, oh, you know, this is nice, and the music is nice, and, you know, there's a message there. But I understand there's some real research behind this approach, this multicultural and sort of different levels of different approaches here, that it really does make a difference. There's some real research on this. Can we talk about, any of you, talk about that a little bit, and what the research has shown, that it's not just something that we can tap our feet to, that it really does make a difference?
Sure, I can start, because you know, we've run you know, real NIH-funded randomized control clinical trials looking at the effectiveness of our programs and of our resources. We've looked at them as standalone products. We've looked at them as, you know, within program and modular programs. We've looked at them within curriculums, and our overarching approach is based on a model that we refer to. It's a little bit of a mouthful. It's called the multisensory, multi-level health education model.
Mm-hmm.
But just to break that down, it's really based on the premise, Max, that human behavior, human persuasion rather, flows from three main sources: credibility, emotional connection, and logic or science, scientific data. And we believe that the most meaningful interaction with content is when we learn something and feel something in a way that makes us want to do something, in a way that makes us want to engage in a particular behavior. So we took these principles, these three pillars: credibility, emotional connection, and science, and we used it to create a framework, the framework that I just mentioned, and then we applied it across the main levels of behavioral influence. To cut a long story short, the tests that we've done, the randomized trials that we've done, looking specifically at knowledge, at skills, and at real behavior change, have shown that our framework, our approach, really does lead to behavior change. And so, yes, it's artistic, it's musical, it's fun. That's important. That's the art domain of our approach.
Mm-hmm.
It's also culturally relevant, which is the cultural domain, and it's scientifically rigorous, which means that we've tested these within trials, and we've shown that they're effective.
So, two of those I will buy into right away. And Mo, I want to have you address this, and that's the emotional connection and the right communicator or communication. But we've seen so much lately denying science, and that's a part that really bothers me. Mo, how much of that have you seen, where you've got to fight or argue or talk to people about the science that you know, it drives me nuts to hear people deny science? Is that a big part of what you've seen in your practice out there?
Definitely. It's really, it's been a bit overwhelming to have to combat so much of the misinformation and disinformation that is circulating in our communities. And I have really tried and put forth a tremendous amount of effort to stay on top of the information that's circulating, and so that I can be familiar with it, and I can make sure to be able to poke holes in some of these arguments that these folks are making, so that when my patients ask me, well, what about this video I saw, or what about this article I saw, I can tell them with confidence, this is why this is incorrect, this is why this is misleading, and this is what the accurate information is. And so this is what we're doing right now is just one tool in combating that. So the onus is kind of on us to stay on top of that misinformation and bring people. We want people ultimately to make informed decisions, accurately informed decisions about getting vaccinated. And so it's a tough fight, but we can't give up.
Yeah. And Anna, Mo brought up a piece of that, which I think is important. Is it's important to try to correct the misinformation that's out there and that people are consuming, but it doesn't mean much if it's not coming from a trusted source or messenger. Do you find that people that in your practice, they trust you and are responding and listening to what you say when you say, no, that TikTok video, that YouTube video, that's complete nonsense? Will they listen to you? I hope so.
So many do, right? And that's part of what we experience on a day-to-day basis when we're seeing patients. We are seeing patients that have still chosen to not be vaccinated. But I would say that at this point, most of the patients that I'm seeing have chosen to be vaccinated. Earlier on, when we were having these conversations, when the vaccine was a little bit newer, there was certainly a lot more conversation around it. And yes, I do feel that I am seen as a trusted messenger. I mean, I'm still part of the system, whatever that may be, because I am working within an institution. But I do think that I'm seen more. I'm seen as a trusted messenger because I am also Latina. Many of my patients are from this community, from this neighborhood, and so they do see me as someone that they can trust more so. And not just patients. I remember when I was like, the minute the vaccine became available, I was knocking things down to try to get my way in to get vaccinated. And I took the selfies getting the vaccine, posted it on social media, and so many of my relatives reached out and said, well, I trust you and you're getting vaccinated, so this must be something that's safe.
Wow.
And so
Excellent.
Yes, these were my friends and relatives, but they were also able to follow my example, get vaccinated when their time came, and also spread it to their friends and others. So, I mean, I think that I can serve as that intermediary between the system and the institutions to people in communities that, we talk about science. I think we're very privileged in that we have that background. We had so many town halls and so many lectures around the mRNA technology, how it worked. We got to a point that we were comfortable with this vaccine. We needed to afford our patients that same opportunity and be the ones that could translate all that information and give them the science behind it. And it's what we've all tried to do over the last few months.
A perfect example of having a foot in both worlds, right? So that people would trust you. Jide, before we go on, I wanted to mention one more thing, because one of my favorite examples of misinformation, in a sense, and people not being consistent with how these things work, is I heard somebody say the other day that I don't want to get the vaccine because I don't know what's in the vaccine, right? And then they turn around and have a hot dog. I don't know what's in that hot dog. Tastes great. I don't know what's in that hot dog. Jide, tell me.
Yeah, no, I just want to just emphasize this whole the issue of credible messengers, because that's really important to hip hop public health. I think one of the things that while we create content that's culturally tailored, culturally relevant, scientifically accurate, etc., it's still really important to have boots on the ground, to have partners on the ground, to have those credible messengers on the ground, having those one-on-one conversations. And so one of the things that we do is we partner with community organizations, with community health workers, with youth organizations. One classic example is our Voices of Vax, Voices on Vax. And here it is, our Voices on Vax, which is a group that we're working with in Baltimore. And these are youth ambassadors from Baltimore, young, incredibly gifted inner city Baltimore champions who have really helped co-create this entire initiative called Voices on Vax in partnership with Johns Hopkins School of Medicine and Heart Smiles. And this whole campaign is taking our content, and they are Baltimoreizing, for lack of a better word, our content, so that the videos and the messages are kind of contextualized within the Baltimore setting. And it's one of the classic ways that Hip Hop Public Health is partnering with real credible messengers, in this case, youth ambassadors on the ground, to drive the message and the importance of getting vaccinated.
It is so important to have that trusted messenger, and I think that's what we saw a little bit with Anna. And Jide said we're Baltimoreizing some of the message there, but Anna, tell me a little bit about La Conversación, or part of Between Us, aboutus.org, because that's a different way of not Baltimoreizing it, but Hispanicizing it. I'm not sure what we would call it.
Yes, and so I was fortunate to participate in another educational campaign around the vaccine, and that was one, again, where there were physicians from Latino backgrounds who could talk about the different myths related to the vaccine.
Darle información a tu cuerpo de cómo pelear la infección en un futuro. Digo que es que está enseñándole al cuerpo cómo desarrollar los soldados para pelear la infección en un futuro. Si en el futuro ven el virus, entonces lo reconocen rápidamente y ya.
And so yes, and so it was great to be able to partner with other physicians to talk about specific myths around the vaccine. And so again, just another way to get that message out. Again, trusted sources of information, speaking in their language, and tailoring the message to our communities. And so yes, I've been fortunate to be able to participate in several campaigns. I've also done some Spanish news shows, and also we'll get that message like, oh, we saw you, again, another relative, I saw you on TV and now so and so got vaccinated. So whatever it takes, whatever way we can get that message out, I'm all for it.
If it's one shot at a time, that's okay. Whatever it takes. It's we used to call it retail politics, right? Now this is retail medicine. One shot at a time there. And lately we've also seen here in New York City, we've seen the I believe it's funded by the health department, real people from the streets talking about how and why they got vaccinated. And they are, they look like people that they just pulled off the subway and say, talk to me about why you got vaccinated. But they're the ones that are going to reach people, I believe. Those are how people listen to folks who look and sound like them. And I think that's why that's a brilliant way of trying to reach people. We saw some of that clip. Is there any more of that clip from La Conversación that we need to that we should see there? Or Dr. Anna, you don't want to see yourself anymore? There you go.
Infección, pero si te enfermas, hay menos riesgo de que sea una enfermedad severa, algo que haga que necesite ir al hospital o ser hospitalizada o hasta morir de esta infección. Entonces, sí, la vacuna ayuda a prevenir la infección, pero si te infectas, entonces usualmente es menos severa.
I think that's so important too, both in English and in Spanish and whatever languages, that it's not necessarily a vaccine that will completely prevent the disease, but it'll keep you from getting a very severe disease or being hospitalized or die. Mo, yes, please go ahead.
Can I just, in terms of that message, can I just say one other thing that I feel is really important and we haven't had a chance to talk about yet? This campaign, the Inmunidad Comunidad, gives that message about how it's also really important for our community to get vaccinated. And so that's one of the things that I've heard a lot. I'm young, I'm healthy, I'm going to be fine, I don't need to get vaccinated. But it's not just about one's own self. There are people within our communities that are more fragile, that are more at risk. And so it's our duty to try to protect other members of our community. And so that's a message that I've used with my patients. For example, if a woman doesn't want to get vaccinated and she has young children, I'm like, well, they can't get vaccinated and you can help protect your children by getting vaccinated. Similarly, if you have elderly relatives who may have gotten vaccinated but would still be at high risk, again, that's another way. So I think that the message with this campaign, where it's about the community and trying to heal the community and have the community overcome this horrific thing that we've been through, is, I think, a very important message, that it's not just about yourself, but it's about those around us, and that we have a duty to try to protect those around us as well.
That's so important. And Anna, in fact, today, the story that I ran on CBS was about Pfizer asking for emergency use authorization for children 5 to 11, right? And the experts that I spoke to said, it's not as important for those kids to get vaccinated, really, because, it'll keep them from getting really, really sick, but they're relatively not immune, but they're not generally not going to end up getting that sick. But these little kids are walking petri dishes filled with viruses, including the coronavirus. And so what they're saying is it's just as important, if not more important, that they get vaccinated, because they're going to come back to a household where you've got perhaps abuelo, abuela, tío, tía, others in there who, are going to be much more vulnerable to really severe disease. So it's important that you're not just protecting yourself, you're protecting others around you. Before we get to a little bit about wrapping up, Mo, tell me, because what we hear so much on the East Coast about what's going on in California is just a lot of the, a lot of the negative stuff, I guess. Let's put it that way. But have the public health authorities out there, be it in LA or other parts, made an effort, sort of like what the New York City Health Department has done, to try to reach people with folks, the right messenger, people who will actually listen to them? I suspect that people who are vaccine hesitant right now are not listening to Gavin Newsom all that much.
I do think that LA County is, we're doing our best. We are definitely making the adjustments as needed. The numbers kind of keep, going up and down. At the height of the pandemic, I'm talking January, February, it was Latino communities that were really bearing the brunt of hospitalizations and deaths and new cases. And the numbers started to go down. The Black population actually overcame the Latino population in hospitalizations, cases, and deaths, because Black people were the least vaccinated in Los Angeles County. And so the numbers of people who are getting vaccinated are going up. And I am seeing that in my practice. I'm seeing more of my Latino patients telling me, oh, yeah, I'm fully vaccinated. I got both shots.
Wow.
But there is, there are some people that are saying, oh, I'm still not sure. I'm still kind of doing my research. And so the, powers that be here in the Department of Public Health are trying to get those trusted messengers into the forefront. And then, kind of what we talked about, unfortunately, there's a lot of confusion, because there are a lot of people who, with the title doctor, that are spreading some of this misinformation. And so people are just confused about who to listen to, who to trust. And so that really needs to be addressed head on. I think that I'd like to also say that efforts to increase and improve diversity within the healthcare workforce is a big part of that, and making sure that trusted messengers are out in the front lines.
Absolutely. Jide, what do you hope, using all these resources and these different sort of groups, what do you hope to achieve through all of this with HipHop Health?
I think that one of the, I think at minimum, I hope that the public health community recognizes the importance of marrying science with emotional connectedness and cultural relevance when it comes to our public health communication efforts.
Amen. Absolutely.
For too long, it's been. I mean, Max, you've been amazing on CBS and even before that on NBC. The way you broke down stories, the way you explained it in easy to understand terms, the way you had, you always had a narrative, you always had a story to tell, and not just. It wasn't just the statistics you were narrating. You were couching it in easy to understand stories, and I think the importance of taking a hard look at the way we do public health and recognizing that if we don't engage communities in a way that it's not just putting information out, but putting out information that they can understand, that they can connect with, and they can use. And I think if at minimum, HipHop Public Health would like to show the public health community that there is a way we can do this rigorously, measurably, and effectively. And that's at the minimum. Now, my dream is that we exponentially increase our direct impact on the ground in communities that need it the most. We want to see increased vaccine uptake, but this is just the vaccine. COVID is here today and will be gone tomorrow. The larger story is the issue of inequity in our society. The largest story is the issue of health disparities, of structural racism. It's the substrate, the what is driving these differences, what is driving these, Monique just mentioned the Latino community were the hardest hit, and then the Black community overtook them. What is driving these numbers? And that is where we need to focus. Once the dust settles and COVID moves on, nothing will change unless we address the fundamental root causes of this issue. So my hope is that we are part of that conversation at HipHop Public Health.
Or that is absolutely the truth. And thank you for putting that in those terms. And thank you for your kind words about my work over the 100 years that I've been doing this. But it really is. This is how you have to reach people here as well as up here. And if you're just saying, here are the numbers, don't be stupid, go out and, get vaccinated or do whatever you got to do. If you don't reach them here, it ain't gonna happen. I know we've only got a couple of minutes here. And I always like to ask our panelists for a little take-home nugget or a take-home lesson. Anna, what do you want people to remember after this is all over?
I want people to remember that the vaccine is safe and effective, and that if you've not yet gotten vaccinated, please do so. And if there are people in your life who have not gotten vaccinated, to please try to reach out to them. Again, our community has been so devastated by this pandemic, and it's getting vaccinated is really the most important thing that we can do to try to lift ourselves out of it. And essentially, that there are a lot of ways to get this message across, and I'm just happy to be a part of a different way of getting this message across. And I'm hopeful that we'll be able to reach, be it one person, but hopefully many people, and convince them that this is really a great thing to do. And again, vaccine is safe and effective.
Great. Mo, I think you're going to get the last word.
As a native of Los Angeles, I want to emphasize the importance of Black and Brown unity as we try to navigate our way through this pandemic. And I want people to always let love and the pursuit of justice to be your North Star at all times.
Oh, absolutely. Absolutely. Jade, you, I think, gave us the take-home message quite articulately just a minute ago. So thank you for that. I want to thank our panelists, and and just try to remember what we've talked about here tonight on HipHop Health, a way to communicate with people. And Jide, I think you couldn't have said it better. COVID-19 has only kind of shined a light on the underlying problem, which is health disparities and health outcome disparities. It's been there for a long time. It's going to be there for a long time, unfortunately, but that is what working to eliminate those disparities is what's going to help us with the future pandemics or whatever else comes down the road. So let's work on that as well after we get everybody, every hardhead out there vaccinated, please. Okay. Again, thank you so much, HipHop Health. Thank you for allowing me to bring these messages to everyone. And please just remember what we've been talking about. It's been an honor and a pleasure. Good night. Get mask up or get vaccinated, or both. Please have a good night.
United, the love life way. Together. It's a symbol of love, a symbol of trust between us. I wear it for you, you wear it for me. Promise. I put on a mask out of respect for the masses and all those left behind. To salute and honor all the first responders battling on the front line. All the goodwill people. If you got my back, my back got your back. Oh, behind the back. I believe. What's to ask? So let's say the word. Behind the back. What time that you feel alone? Just know you're not invisible. 'Cause I still see you behind the mask.
I see you, I feel you.
Now we can't pretend the state that we're in not dangerous. 1 minute we're close, then 6 feet away like strangers. There's a virus outside threatening all our lives, and we can't let it in. Not just for you, but for all. To prevent a loss, we put on the mask for them.
Come on, y'all.
If you got my back,
I got yours.
your back.
You got mine.
Behind the back, I got your back.
Here we go.
What's to say the word?
That's right.
Behind the back. And if you feel alone,
Come on.
just know you're not invisible.
We in this together, y'all.
Still see you
I see you.
behind the mask.
I feel you.
I see you. I see you. Still see you.
That's
See
right.
you behind the mask.
And I feel you.
Here we go.
DMC.
Here's a little story about this year. Who would have thought we would end up here? New decade, we was barely in it. New year came with a world pandemic. It will get better, the storm will weather. Heads held high as we stand together. Gotta do our part to stop the spread. Gotta pull together, don't be misled. Wash your hands, make sure they're clean. 20 seconds or more if you know what I mean. Put a mask on, it don't matter what kind. The cloth, surgical, or the N95. Before you take your mask off, go wash your hands off. Roll it outside so you can keep the germs off. Start a mask in a paper bag. Then one last time, go and wash your hands.
That's right.
Got your back.
and I'm with you all the way.
Yeah, I still see you behind the man.
Ladies and gentlemen, this is real right now. Raheem Devon, DMC. My name is Doug E. Fresh. Please wear those masks. Is that a lot to ask?